So I invite Dr. Mihir Mishra, who is the quality head of our institute, to talk about OT practices. So you first build it, then you clean it, you surveil it, and lastly you behave properly in it. Because if if you have everything but our behavior inside the etiquettes inside the OR is not fine, everything will fail. Dr. Mihir.
Thank you, Dr. Samrat, for inviting me for this IC. And thank you, AIOS and APAO, for including this IC in the conference. And welcome, delegates. Good morning. So I'll be dealing about entry to exit. Means whenever you have a OT setup, entry means you have to enter inside and do the work and come out of it. So whatever goes inside the OT, that is the processes, and whatever etiquettes you have to follow in the OT, that is the paramount importance, because until unless every process is made, but if you do not follow or you do not strictly adhere to that, then it is a waste for them, and it will breach the sterilization and other processes. No financial interest. So operation theatre is a complex working environment where technical and non-technical skills both converge, aiming to maximum efficient outcome of any procedure done. So it has skilled personals and non-skilled personals also. In traditional medical curriculum, technical development is emphasized and non-technical skills, mostly the soft skill, which is important, which governs the surgical outcome, is basically overlooked. So we have to make emphasis on the soft skill of the staff which is associated with the OT. The processes includes the technical processes, that is the instruments, equipments in the room, which requires all the sterilization processes. Next is the organizational workflow processes, that is the workflow time, methods of work, and the standard operating procedure which we have laid down. And the social process, that is a soft skill which is important, which is very much important for the coordination. So that is the knowledge of the OT part and what is used in that, the skills, the attitude, the motivation, and the level of cooperation. So why there is a need? Of course, these are all relating to the OT, which is a very sensitive area and the heart of the hospital, and it is relating to the infection, it is relating to the contamination, biological contamination, and any mistakes or wrongdoing will lead you to court and you will be finished. So surgical and anesthetic accidents may occur if you don't have a good infrastructure or not properly handled. And 2.5 of the all surgical patients have some acquired wound infection, that is a surgical site infection. So any eye infection can culminate in extremely devastating consequences for the surgeon and also for the patient. So for that, better to have a standard operating procedure, whatever way you have, but you have to lay down a single procedure for all the staff and also for the personals who enter into the OT, so that they know in and out of what is the processes which has to be done inside the OT. And that is a vital component in any quality management system. You have to have full compliance with guidelines and regulations, mirror current organizational practices, and what it helps in, it decrease variation in care, it improve the guideline compliance, and improve the overall quality of care. So coming to the standard OR etiquettes, now minimum infection prevention practices that apply to all patient care, which is regardless of suspected or confirmed infective status of the patient in any healthcare setting. And second is to protect the healthcare professional from getting infected, as well as to prevent the personals themselves from spreading infection amongst patients. So these are two parts, one is the patient and one is the staff. So there should not be any exchange or any transfer of infection from towards each other. So what are the people who are involved in this? Those are the surgeons, the anesthetists, the scrub nurse, the circulating nurse, the assisting surgeons, the OT technicians, and the assisting paramedical staffs, and the other staffs, whoever, if at all you have. So coming to the most important part is the soft skill, because until unless you have the etiquettes, then everything goes waste. So this includes the honest qualities which I will be dealing about. Knowledgeable, he has to have complete knowledge of what he is doing and where he is there. Physical stamina, he should be well, of course, fit enough. Emotional stability should be very much in good emotions. And dependability, patience, sensitivity, understanding, responsibility, good judgment, good communication, and interpersonal skills, most important here for coordination. Cheerful and practical, caring for people of all ages, that is patient care and also the care of your peers. So these are the 10 points which I have shown, which are paramount importance and minimum these has to be followed. Time management, communication, adaptability, problem solving, teamwork, creativity, leadership, interpersonal skills, work ethic, and attention to detail. So of course we have variation in our own nature and characters of everybody, starting from the low to the up, including the surgeons also. So we have a stereotypical surgeon personality. So these are no's which have crossed, and the other part is decisiveness, the well organization amongst the persons and the patient and the staff care, the practicality of work, and the hard working. You have to be hard working, of course. And the assistants, mostly they have to have understanding, perception, and familiarity, because this is basically teamwork. So everybody has to know the other person and his needs, because it should be a very smooth flow rather than having a very miscommunication or any sort of a problem inside it. So coming to the general OT etiquettes, we learn about the operation theatre zones, which are already told about. So SOP has all these things included in this: the sterilization, the zones, the sterilization zones, and the other part. So they should be well aware of it. The healthy and safety information, the compliance and the response etiquette to capacity building, and the efficiency enhancement of the team. To be familiar with the WHO surgical safety checklist, which we have prior taking to the patient in the OT. There is a checklist. We have to see the right side, the right procedure, and other things which are to be mandated before the procedure. Identify and deal with hazards in the perioperative environment. Acquire proper knowledge on infection control, hazard substance, smoke, plum, gas, lasers, sharp safety and associated injury, risk assessment, PPE requirements, manual handling, waste management, damage to equipment and building, fire safety, stress and equipment handling. So these are all important aspects which is dependent on the type of work you have and the area which you are designated. Coming to the other part, so this is basically personal part, which personal belongings like bags, cell phones, laptops, jewelry, wristwatch, anything extra from you should not be entered into the OR. Abide by rules related to access to information and confidentiality. The patient MR numbers or any sort of information should not be breached to anybody else, mostly the patient attenders or anybody. The photography, video without permission we should not do. So we should have a consent from the patient also that we will be taking the photographs or videos, and it will be used for further purpose or research or any educational purpose. Then give value to privacy and dignity of the patients. Sign the attendance visitor book as per the norms of the given OR. Then of course behave professionally, arrive before time, change street clothes with proper attire. Then healthcare workers, observer or support staff, including the surgeons also, be silent and modest, ensure responsible and respectable communication, be sure that you are in good health and report to in charge if unwell, be silent and modest, and always ensure responsible and respectable communication. So these are again I am emphasizing because this is most important. Now coming to the other part of it, the actual going into the OTR, main OT. So know the details of surgical scrub, the duties, the limits and responsibilities of scrubbed and circulatory personnel, not to touch any sterile equipment and personnel already scrubbed and gloved, and only scrubbed personnel can be in the sterile zone and other will be in the circulatory zone. Be familiar with the WHO surgical safety checklist, which is already available in the net. Now coming to the surgical attire, it is mostly referred to the clean and sterile clothing worn in the OT to provide effective barriers that prevent the dissemination of microorganisms to patients and protect personnel from any blood or body substance of the patients, vice versa, which you call. And that includes the personal protective equipment, that is the mask, the cap, the scrub suit and the gown. So these are components of the PPE. There's the scrub suit, which designed for maximum skin coverage, which has a potential source of microbial contamination. The caps, head and the facial hair should be covered, of course, whole of it. The masks are mostly disposable, well-fitting deflector are worn, and cloth masks are, of course, ineffective barriers for microorganisms, should not be used exactly. And shoes, dedicated footwear is recommended for use in the OR. Slippers will be different for the toilet use, and it should be kept separate. and it should be daily washed with detergent and dried. The sterile gloves, of course, are worn by all the scrubbed members of the surgical team and should be changed after every case. The gowns and drapes, these create a barrier between the surgical operative field and potential sources of microorganisms. So they are ideally made of material which is impermeable to liquids. So disposable drapes are also available, gowns, so that can be also used if feasible. So preparation by the OT personnel: have a good meal before entering the OT and empty the bladder. So you are not in a hurry to go somewhere else during the procedures or during the your period of work. Switch off your phones and keep them in silent mode. Remove your jewelry. Make sure you go through the patient's medical records about the surgery beforehand. Wear the OT gears. Confirm the patient identity before shifting patient to OT. Cross verify if the procedure consent is signed before the patient shifting. Then ensure patient dentures or movable artificial teeth which are before the shifting the patient, because this is during the anesthetic procedure, it is very important. So you have to just inform the patient or the attender mostly if there is any problem, or you foresee any problem during the anesthetic procedure. Mark the surgical site and side before patient is shifting in the OT. So coming to the preparation for medical personnel, you should have punctuality, alertness, use of sign language, phonation and language, because you cannot just have a straight talk when the patient is on the bedside and he is hearing everything on you if it's a local anesthesia. So be wary about it. Administrative skills has to be there with personalizing and preparation of self for surgery. You have to prepare yourself for the surgery. You have to know what to do, plan it before. Identification and consent of patients should be seen actually, and use of cell phones within the OT should be restricted. So decontamination, surgical hand washing is required before performing in surgical procedure. So all ornaments should be removed from the hands at the time of scrubbing. The quality of water should be lukewarm water, and it should be like AquaGuard can be used for that. We have dispenser which may be automated or it may be a manual one. Then hand washing and arms are 2 inch above or below the elbow, and clean fingernails under the running process. We have all the various types of cleaning instruction which is standardized here. So this has to be followed, and this should be always put near the wash machine or the scrub area, so that the person can see and he can follow those steps for hand scrubbing. So chlorhexidine or povidone 10% can be used, and hand are dried before donning the glove. Coming to the OT inside, the proper downing has to be done for the gloves, and we should not touch anything other than the sterile instruments and operating field with the gloves. And do not come out of the OR if with the gown and the gloves in hand, and disinfection of the hand before or after downing is the rule. So this is how you take out the sterile packs for the gown. So processes may be different for you, but you have to have the sterile chain which has to be followed. So it's not exactly that you will do the same thing, but ideal you should follow those things which help you in giving the sterile maintenance towards it. So these are no touch. Once you have inside the OT and you have wore the gown, there's no way in touch to anywhere else. Now inside the OT, follow the correct gowning and gloving already done. The back of the gown area, which is the area of the breast, should be considered unsterile, so you should not touch anywhere. The gloved hands are kept above the waist on the top, and the sterile field and clasped in front. So coughing, sneezing are avoided, and if you have something, you should go in the other side of the or make a sidewise movement. So again, this process of gowning depends on your type of OT gowns which you have. Now these are of course not the right proper way to stand inside the OT with all the surgical attire. Better to avoid it. Now circulating ONA in OT, you have to have the hands must be kept behind the back, so not touch or lean over the sterile field, so not pass item over the sterile field, and check sterility expiry date of each pre-sterile pack before opening, and sterile item is not used immediately, should be kept covered. While pouring liquids in the container jar, you should hold 6 inch above the sterile field. Now coming to the role of the scrub nurse, which is very important. So quick reaction, anticipation, and conscious observation should be there, because you have to coordinate with the surgeon. So draping and trolley preparation is most important, properly done depending on the surgery which has to be done. So limited mobility of scrubbed person, maintenance of instrument and equipments, and suction cautery tubings and other connection has to be properly placed. So good habits in OR is limit the number of people who enter the OR, clean and disinfect all the horizontal surfaces after
Dr.
each
Mihir, you
case.
need to wrap it up.
Yeah, just 1 or 2 slides. Avoid hurried action that might distract surgeon and patient. Assistant should face the surgical field area and closely watch the surgery, and scrub personnel should pass each other to back, and no unnecessary change of assistants. So these are all important for observers also. So they have to be in proper way. Crossing between sterile field is avoided, and there should be a 1 feet clearance. Woolen wares and other to be avoided in here, and because there is a CCTV, you should not have any crowding, or you should be properly maintaining the etiquettes. So patient with HIV, HBV, you have to have important care, and you should have extra barriers for that, which is laid down in the protocols, and you should basically have a color code in the patient file so that it can be identified by all staff, and they should take the proper precautions for that. Documentation, you have daily OT checklist, daily OT reports, which has to be maintained so that you go along with the processes. There should not be any breach in the processes. If there is any there, then it should be taken care of immediately, or the day which is done. So on the backdrop, the surgeon is accountable and responsible in the court of law for whatever happens in the OR. Proper SOP with adherence can efficiently reduce the adverse events and can improve the outcome. Enhancement of the teamwork, performance, and commitment can be done by behavior management, and it is important for safety of all, which is achieved with barrier and prevention by complying to the etiquette norms. So these are some guidelines which are there, and you can also refer to that. So that has all the details also. Thank you.